Epilepsy is one of the most common neurological disorders worldwide. In fact, as of February 2024, the WHO estimates that 50 million people worldwide have epilepsy, with about 80 of them in low to middle income countries, like Kenya. But what exactly is epilepsy? Why the stigma? And how do we approach it clinically? Epilepsy is defined as a brain disorder characterized by a tendency to have recurrent, unprovoked seizures. That last part is important. Unprovoked means that the seizures are not triggered by an immediate cause like low blood sugar, alcohol withdrawal, or acute infection. Instead, epilepsy reflects an enduring predisposition of the brain to generate abnormal electrical activity. Remember, not all seizures equals epilepsy. Epilepsy doesn't discriminate. It affects people of all ages. Seizures are the hallmark of epilepsy, but they don't all look the same. Some involve brief, staring spells or subtle automatisms. Others may cause dramatic convulsions, loss of consciousness, or sudden falls. Recognizing seizure types is essential because it guides both diagnosis and treatment. The International League Against Epilepsy divides seizures into two broad categories. Focal seizures. These begin in one part of the brain and may or may not impair awareness. And then generalized seizures. These involved both hemispheres from the start, such as absence seizures or generalized tonic-clonic seizures. The classification helps clinicians tailor therapy to the patient's seizure type. Diagnosis is primarily clinical, relying on a detailed history from both the patient and a witness. Investigations include EEGs, which can detect epileptiform discharges, and neuroimaging, usually an MRI with seizure protocol, to rule out structural causes like tumors, stroke, or cortical malformations. Treatment aims to control seizures and improve quality of life while minimizing side effects. First-line therapy is usually with anti-seizure medications such as levetiracetam, lamotrigine, or sodium valproate. About 2/3 of patients achieve good seizure control with medication alone. For drug-resistant epilepsy, there are surgical options like temporal lobectomy, or palliative procedures like vagus nerve stimulation can also be considered. Lifestyle, counseling, safety education, and psychosocial support are equally important since epilepsy can affect driving, employment, and mental health. And because of that, managing epilepsy effectively requires a team-based strategy. Neurologists and neurosurgeons provide diagnosis, drug therapy, and surgical intervention. Neuropsychologists and psychiatrists address cognitive effects, depression, and anxiety, which are also common in epilepsy. Nurses and clinical officers play a crucial role in medication adherence, patient education, and seizure first aid. Social workers and community health workers help patients navigate stigma, employment challenges, and access to care. Rehabilitation specialists, including occupation and speech therapists, support patients with functional or developmental difficulties. And finally, the most important, family and caregivers are central to monitoring seizures, ensuring adherence, and providing emotional support. This collaborative model recognizes that epilepsy is not just about seizures, but about the whole person's well-being. So, in summary, epilepsy is defined by recurrent, unprovoked seizures, affects roughly 1 in 26 people, and requires careful classification, investigation, and a personalized multidisciplinary approach with timely diagnosis and coordinated care, most patients can lead fulfilling lives. Thank you for listening and have a blessed day.